What is an APP? APP stands for Advanced Practice Provider. It includes physician assistants and nurse practitioners. We're all healthcare professionals that have undergone advanced education and clinical training to perform many similar duties to those of a physician. Fun fact, some nurse practitioners have also continued their education and have gotten doctorate degrees as well. All this training allows us to diagnose illnesses, order and interpret tests. We can prescribe medications and also perform minor procedures. APPs work in all settings, including inpatient in the hospital. We're also outpatient in clinics, whereas I've seen a lot of you guys, and sometimes even in surgery. APPs have expanded to be in every floor of the hospital and in every specialty. So why do we need APPs? APPs have been more prevalent in the medical field as there is an increase in shortage of physicians in primary care and other specialties. Some reasons for this shortage include increase in demand as the population is aging. There's also retiring physicians. There's training limitations for new physicians, and there's federal regulations that restrict the number of residency programs in the United States. But also, the physicians that we do have are very busy. As many of you know, they're all doing surgeries, sometimes very long surgeries. They are in clinic, seeing several patients every day. They also work on their own research projects, and they're part of several committees that has them have several meetings every week, and they're also teaching the new generation of physicians. So how do APPs help? Not like that. We help by expanding access to care and extending coverage for our patients. We are able to see patients independently, making it easier for patients to come see a provider sooner than they would be able to see a physician. We, in general, have more open schedules as well, which allows us to see our established patients should they call in with any concern or question. We also make it easier for patients to get treatment faster. We can refill your medications a little bit faster. We can answer your MyChart messages and phone calls faster. And we're also able to discuss pathology and imaging with you and your loved ones. And we're here to repeat and explain any information that was discussed during your visit. We can also place referrals to specific specialties, including nutrition, physical therapy, survivorship, palliative medicine to help manage your pain, and any other specialty that you might need. A few of us have also gotten involved in facilitating some support groups, which has been actually my personal favorite because it has allowed me to see my patients outside of the clinical setting. And it has helped me understand your journey better, including your achievements, family support, fears, and more. And finally, if we don't know the answer to one of your questions, we know how to find your physician. There is a role also for us in research and clinical trials. Some of us have completed research-specific training that allows us to complete specific or study-specific items, such as evaluating patients on our own if your physician is not there. We're also able to sign orders and interpret results. But most importantly, alongside with our wonderful clinical trial coordinators, we are always available should you have any questions about your clinical trial, including any symptoms or concerns related to your clinical trial medications. Our goals. As an APP, I have developed a couple goals for my personal practice. My number one goal is to make sure that our patients and their loved ones fully understand their diagnosis in the plan of care. You and your loved ones are part of your team as well, and I believe that everyone in the team should be fully informed. Another goal of mine is to make sure that I listen to our patients' concerns and questions, making sure that you feel validated and listened to. I am able to accomplish this by giving the patient the time that they need during our visits. And my third goal, which is more of a personal goal for me, is that I want to make sure that I understand that our patients are regular individuals. You have lives outside of the 15 to 20 minutes that we see you in clinic once in a while. So I want to know more about you. We want to see your travel pictures, we want to hear about your grandkids, and we want to know about your hobbies and jobs. Aside from APPs, as most of you know, when we're treating an individual for cancer, there is an entire team that's dedicated to you. As I said before, the most important person on your team is you and your loved ones. You are the center of the team and what keeps us all going. I wanted to explain a couple other individuals that are also on our team that are ready and happy to help. We have patient care assistants who will be getting vital signs and lab work while you're in clinic. We have our care coordinators that help us gather any medical records from outside facilities. We have our nurses that pretty much do everything. They really do everything. We have patient care resource managers who will help answer questions and help with supplies. We have nutritionists, pharmacists, and social workers. There's also our clinical trial coordinators that know everything there is to know about a clinical trial. And we have our schedulers that will help set up your future visits and surgeries. And then there's finally APPs like me. We have our residents and our physicians as well. So what I would like for all you to take away from this presentation is that APPs have become more prevalent in the medical field. It is not rare anymore that patients get to see a physician assistant or a nurse practitioner during visits. From my colleagues and friends, I have determined that there is one thing that has attracted us all to this career, and that is our passion to help and make a difference.